JD Vance's young relative denied life-saving transplant over vaccine status, family claims.
Adeline's heart cannot be fixed, but it can be replaced through the organ donor network. Her doctors at Cincinnati Children's led her parents through the process last month.
They just told us about the different testing that they need to do, and then the vaccinations that they need to do.
When they said that, you probably went, wait, vaccinations?
Yes.
Adeline's parents say their religion and their own research has led them to reject the flu and COVID vaccines.
And I'm like, so if we don't do the vaccinations, are you just going to let my child die? And she's like, I am so sorry. She goes, this is just our policy.
The American Society of Transplant Surgeons agrees with children's policy, saying transplant candidates and recipients frequently interact with other at-risk individuals in the hospital. The ASTS recommends routine vaccination for all organ recipients and for those on the wait list.
Nothing should be forced on us. I mean, it's our God-given right. We can say no.
After all we've learned about the COVID vaccines and how pointless they are to give to kids, these medical people are still doing this. You may recall this is not the first time we've heard a story like this. Let's rewind a little.
Tracy Ferguson speaking out because her 31-year-old son DJ can't. He's waiting on a heart transplant, but is being denied because he won't get the COVID vaccine.
My son's in the hospital, and he needs a heart transplant.
She says DJ has been fighting for his life at Brigham and Women's Hospital, but she says he's been told he's not eligible due to hospital policy.
I couldn't believe it. And then he said to the doctor, so you're going to let me die?
She says her son is concerned about the side effects of the vaccine. Some hospitals, like Cleveland Clinic, require living donors to be vaccinated too. That policy put Mike Gaiman's kidney transplant on hold just days before surgery. Mike was vaccinated. His living donor wasn't.
While this may seem ridiculous and quite frankly evil, I think we owe it to ourselves to at least hear a defense as to why hospitals are doing this.
If you have a disease like COVID, when you get immunosuppressed, when they give you drugs to prevent the transplanted organ from rejecting, it's really likely it's going to flare up. As a matter of fact, you require flu shots, measles shots, tetanus, booster update. So the centers are basically doing what they usually do, which is to say, we can't put you at risk of dying from the transplant. We can't lose the organ. You've got to be vaccinated. Many transplant centers are just going to say, we can't face those kinds of risks. We have too many other people who are likely to do better, both survive longer and have a higher chance of survival. And I think that is defensible.
So all of this comes down to people's view of vaccines. Dangerous and pointless, or life-saving and crucial? As you saw, this girl is linked to JD Vance, though there is a bit of distance. Janine Deal, the mom of the 12-year-old from Indiana, is related to Vance's half-siblings through marriage, and the girl is adopted. So go ahead and map that out and see if you can understand that. But since we're linking this to JD, let's hear his thoughts on the COVID vaccine.
I took the vax, and I haven't been boosted or anything, but the moment where I really started to get red-pilled on the whole vax thing was the sickest that I've been in the last 15 years by far was when I took the vaccine. I was in bed for 2 days. My heart was racing. I was as sick as I've ever been for 2 days, and the worst COVID experience I had was like a sinus infection. I'm not really willing to trade that.
Ohio State Representative Jennifer Gross is reportedly looking to introduce a bill that would make it illegal to deny care to people who choose to be unvaccinated. For now, it seems, this girl is looking to get a transplant from a hospital that doesn't have such a strict policy.